Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then once she is finished, we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before I get to today's numbers, I want to spend a few moments talking about the challenges posed by misinformation and the importance of sharing reliable sources. It's been almost 11 months since COVID arrived in Alberta, and I know that we are all tired, stressed, and frustrated. There is no one right way forward to navigate this pandemic, and it's natural to sometimes disagree about what that right path is. I have said before that having an open, respectful dialogue is important. We need to talk to each other, listen to each other, and work to support each other, even if we don't always agree. Given the scale and speed of changes in our understanding of COVID-19 and how it behaves, it's also natural to have questions and want to know more. And there's just so much information available, especially online. Over the last few months, you may have heard the term infodemic used to describe the overabundance of information, online and offline, about COVID-19 and related topics. It can be overwhelming to wade through all the data, opinions, and stories out there and to know what to believe and how to respond. Now more than ever before, it's critical that we are all informed by verified facts and informed analysis, and that we are making the best decisions for our individual and collective health and safety. I want to encourage all Albertans to be thoughtful and appropriately critical of what you see on social media or any other platform. Take a moment to assess the accuracy and consider the source of any information you read before you believe it or pass it along. Look for information from a reputable source, which ideally can be confirmed by multiple other reputable sources. When you can, promote content reviewed by people with expertise in epidemiology, infectious diseases, or public health. That will contribute to informing people. It helps keep us all safer and helps stop the spread of misinformation. It's also important to look at the date something was published to see if the information is recent or remains relevant. Our understanding of this virus, the different symptoms, strains, long-term effects, and vaccines has grown significantly over the last 11 months and keeps growing. Information from last spring or summer may not be aligned with best current evidence. Each of us can help combat misinformation and disinformation. This is another way we can all support and protect each other. Turning to today's update, we have now administered 99,814 doses of vaccine in the province. This includes more than 10,000 Albertans who have been fully immunized with 2 doses. Over the last 24 hours, we have identified 366 new cases of COVID-19 in the province and completed about 8,300 tests. Our current positivity rate is about 4.4%. There are currently 266 active alerts and 12 outbreaks in schools. This is about 12% of the schools in the province. These schools have a combined total of 526 cases. Currently, there are 626 people in hospital, including 108 who have been admitted to the ICU. Sadly, 14 new deaths were reported to us in the last 24 hours. This pandemic and the current restrictions make it harder to grieve in many traditional ways. I offer my sympathies to anyone who is mourning the loss of someone near to them, no matter the cause. We are monitoring the spread of COVID-19 closely in Alberta, and we continue to discuss when it may be safe to begin easing further restrictions. I know that many Albertans and impacted businesses are eager to reopen and wishing we would move more quickly. This is understandable, and I wish it were not necessary to keep the current measures in place for a little while longer. But we must be cautious, recognizing that the health system in all parts of the province remains under strain. The rise of new variants in Alberta and around the world also makes it vital that we not move too quickly, which could have dire consequences for our health system and our health. Police agencies and public health inspectors continue to respond to complaints about facilities failing to practice appropriate COVID-19 protocols. AHS and law enforcement always seek to work collaboratively with businesses and organizations to ensure compliance to the orders in place. It is only when significant risk is demonstrated or continued non-compliance is noted that health inspectors resort to enforcement action. But they will enforce orders when needed. COVID-19 has been with us for close to a year now. Albertans from every corner of our province have been affected in both big and small ways by this pandemic. Sadly, I have been informed of several instances in recent weeks where healthcare workers, including public health inspectors, immunizers, and other frontline staff, have been mistreated, verbally abused, or treated disrespectfully while carrying out their duties. It's understandable that strong emotions and responses to certain situations are occurring. We recognize that Albertans are worried right now about their health, families, finances, and their future. I understand that continuing to follow COVID-19 restrictions is difficult, but harassment is never okay, and it will not be accepted. Healthcare workers work hard every day to protect the health, safety, and well-being of all Albertans. We need to remember that COVID is the enemy, not one another. Frontline health workers, including public health inspectors, are protecting their communities, and they need all of our cooperation. Right now, more than ever, we need to work together, support one another, and choose kindness even when, and especially when, it is difficult to do so. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
First is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. The situation with new variants can change very quickly. How do you explain to Albertans why weekly as opposed to daily updates on variants are being posted? And how come there's no breakdown of where these cases are by zone, similar to what is done with other COVID-19 cases?
Right now, our number of variant cases is relatively small, and we need to recall the importance of privacy protections. And obviously, as our reporting for COVID-19 overall has evolved and changed, we will be looking to the needs of Albertans as we go forward to determine how we can best inform them with respect to information about the variant. The reporting that we're able to do right now with COVID-19 is able to be automated with respect to running through our data systems, whereas right now the reporting on the variant strains, the variants of concern, is being done manually, and it's a more labor-intensive process with respect to verification and communication. So we continually look to improve. And again, we will be making sure that Albertans know where the risks are and how that's impacting our decision making. And as we're able to improve our reporting, we will look for ways to do so.
Operator, could you put through the next question, please?
Next is Janet French with CBC. Go ahead, Janet.
Hi, Dr. Hinshaw. I just had a question about the rapid test kits. We got 800,000 back in December. Has any thought been given to using any of these kits in schools? And I'm also wondering if you could tell me how many of the kits have actually been used so far.
We'll have to get back to you with the number of how many have been used. I don't have that in front of me. Where those kits have been used is in locations where there's a far distance in terms of access to the laboratory. So in some rural or remote locations, the rapid test kits are being used, as well as outreach protocols for in long-term care centers or other centers that are having an outbreak to get the rapid results. We're looking at piloting those in regular screening in long-term care. And so with respect to schools, that currently is not being used. And again, we need to make sure that it's very clear that these kinds of rapid tests are useful as a snapshot point in time. They are licensed for use in individuals who have symptoms. And again, in schools, ideally those who have symptoms would not come to that school. So we're looking to the pilots that we're running in some of these other locations to determine how well they work in individuals who have no symptoms and no exposures, because it's in those settings that they could be useful, for example, in schools in the future, but we just don't have that data, and that's not currently how those tests are licensed.
Operator, could you put through the next caller, please?
Next is James Keller with the Globe and Mail. Go ahead, James.
Hi, Dr. Hinshaw. I've got a question related to the protesters that were outside the home of Saskatchewan's health officer over the weekend. What did you think about that when you heard about this? And have you had any concerns about your own personal safety, particularly as we see these anti-lockdown, anti-mask protests? Have there been any incidents that have concerned you or prompted you to take additional steps for your own personal security?
I heard the report of what happened at my colleague's house, and it's very disappointing to see people choosing to take that action. As a public health professional and in my role as a servant to the public, I have heard for many months many different opinions from Albertans. Some have expressed those opinions in very respectful ways, even when they have disagreed, and I really appreciate that, because that is the most productive form of dialogue, is expressing dissenting opinions, but in a respectful way to encourage ongoing discussions. Others have been less respectful, and again, that's not the most productive way of expressing concerns. So what I would encourage all Albertans as they're thinking about the current framework is to recognize that the best way forward is to be considering how we can further that productive and respectful dialogue.
Operator, could you put through the next question, please?
Next is Matt Woodman with CTV. Go ahead, Matt.
Hi, Dr. Hinshaw. We've heard that a big American TV show is coming to Jasper to film in the next little bit. I'm just wondering, given that so many American TV crews are going to need to come over to the border in order to do this, what kind of approval did this TV crew and this TV show need, and what kind of hurdles need to be cleared in order for this to happen, considering we're under a lockdown right now and Albertans are told to stay home and stay safe?
We have been working, my team and I, to put together a framework for professional film industry in general. We know that in many other provinces, BC, Manitoba, Ontario, they do have frameworks that allow, with certain safety precautions, some of those industry events to proceed. With respect to crossing the border, that would be a federal decision. And so if there are any of those kinds of activities that are looking to come into the province, it wouldn't just be a provincial conversation, there would be a federal conversation as well. And as we look to any decisions that we make, number one is whether or not there's any risk to the public, whether any of the activities could potentially cause spread and cause a public risk. And then number two, as we consider any potential requests for exemptions, we also consider the broader public interest and what might be in that broader public interest. And again, that's part of these considerations as we look to this film industry framework that we're working on.
Operator, can you put through the next caller, please?
Next is Bill Kaufman with Post Media. Go ahead, Bill.
Yes, hi, Dr. Hinshaw. Some other provinces like Quebec and Ontario have been lobbying the federal government for tougher travel restrictions, including mandatory quarantine in hotels, flight bans from countries that are showing these variants. Do you think Alberta should be pushing for the same thing?
What we've had the advantage in Alberta of having for many months now a very high proportion of our incoming travelers getting tested twice, and that has allowed us to have a better understanding of the risks when people are coming in across the border. It's really critical that whatever is considered in terms of a framework to make sure that we are limiting and preventing that risk of introduction of the variant into the country and into the province, that testing be a part of that, because without doing that additional ongoing testing, it will be difficult to know exactly what might be coming across the border. So it's very important at this time that we look at ensuring that our borders are lower risk, which is one of the reasons why yesterday we moved to restricting activities on those who are crossing the border and who wish to partake in the border pilot. But I would just say that, again, whatever measures are put in place, it's critical that testing be a part of that framework.
Operator, could you put through the next caller, please?
Next is Lauren Pullen with Global Calgary. Go ahead, Lauren.
Hi, Dr. Hinshaw. Thanks for taking the time to answer my question today. With how contagious the new variants are believed to be, does the province have a plan it can execute quickly for if we see definitive community spread of these new variants? And what does that plan specifically entail?
The benefit that we have is the robust work that's happened to expand our contact tracing teams is able to be deployed to focusing if we do see that there is potential for a particular case to have been transmitted in the community. And so we would be using the teams that we have at our disposal, local public health professionals, local medical officers of health, and those contact tracing teams to be able to move very quickly when we see some of those indications. So as I mentioned yesterday, where we have a case where we're not sure that we've identified over the weekend where the source is, we're doing both the forward tracing and the backwards tracing to try to understand where that came from, as well as aggressive testing to make sure that we are monitoring any potential for onward spread and putting a stop in place around that. So again, it's an enhanced version of what we typically do with all COVID cases, but with a greater focus and making sure that, again, we're very deliberate about that additional testing and focusing on those who have come in contact with those cases.
All right, we've got time for 3 more questions. Operator, could you put through the next caller, please?
Next is Jennifer Lee with CBC. Go ahead, Jennifer.
Hi, Dr. Hinshaw. My question is about the coronavirus variants as well. I'm just wondering regarding that first case with no known, connection to travel that you announced yesterday. What has the investigation turned up in the last 24 hours or so in terms of any potential contact to connection to travel or any further spread? And then from a bigger picture perspective, I'm wondering what you can tell us in terms of what we have seen here in Alberta in terms of the spread to close contacts in all of the variant cases that we've identified so far. How many close contacts, like household contacts, have ended up testing positive, and what kind of trends or implications are you seeing from that?
With respect to the first case, there has been a limited amount of household transmission at this point. At this point, again, we don't have any evidence that it's spread further beyond the household. We don't at this point have a known travel link, but we do continue to investigate. With respect to listing of all of the different variant cases and any potential secondary cases, that information actually is something that I've asked the team to summarize overall. Right now, I don't have a specific overview of exactly how many individuals have come into contact with these imported cases. We have seen a limited amount of household spread. I don't have a specific number, and that's consistent with what we see even with the regular strain, which is that transmission within households is very high risk of that happening. And again, just want to make sure that Albertans understand the importance of following all of our typical protocols, because what we have seen in some of the early variant cases that came in is those who did follow all of the protocols, there was no transmission even within the household. And where sometimes there was some slippage, or again, it's difficult sometimes when you're living in the same house as people to stay apart from them. That's again where we did see that transmission. So it's It's something, again, that we need to make sure that we're all in our regular everyday lives following the protocols, following the public health measures, because those measures are effective, whether it's the typical coronavirus, and it also can help us prevent spread of these variants.
Operator, could you put through our second last question, please?
Next is Dylan Short with the Edmonton Journal. Go ahead, Dylan.
Hey, Dr. Hinshaw, I'm just looking at some online numbers here, and it looks like the amount of unknown, or the amount of active cases with unknown origins is down to about 3,000, which is obviously much better than the around 90% of unknown cases that we had at one time. I was just hoping for an update on where the contact tracing efforts are. I know that before we hit the new year there, we were still looking to hire contact tracers. I was just looking to find out where we're at with hiring contact tracers and sort of how we're tackling the remaining backlog that's still in place.
We can work with Alberta Health Services to get you a number of the current number of contact tracers. Alberta Health Services is continuing to hire contact tracers. They currently have enough capacity in their teams to be able to call all cases within 24 hours of that case being identified through the lab, which is great. What you see on the dashboard when you're looking at that active case tab, the unknown source includes those who've been lab identified within the last 24 hours and perhaps either haven't had that phone call or that contact tracer hasn't had a chance to enter the data into our online data systems yet. So there's always, when we look at the daily numbers, it does take 1 to 2 days for those new cases to have that data entered in. So there will always be a proportion of unknowns that show up on that particular view on the dashboard. It's also important to remember that because COVID-19 can incubate for up to 14 days, it is sometimes difficult, sometimes not possible to identify the source of a particular case. And in those cases, even after that interview has been completed, that case investigation, sometimes despite the best efforts of the individual and that case investigator, it's not possible to determine where the source was. So that's, again, we will always have a proportion of cases where there is an unknown source. We are working to get more granular data. Right now we have relatively good sense of the numbers that are close contacts to a known case, those that are in outbreaks. And we have, now our next step is to try to move down into a little bit more granular data to understand the types of activities where the exposure is happening. I know that's something that Albertans have been asking for, and we're working to put that together in a more granular way to be able to share that with the public.
Operator, could you put through our final question, please?
Final question is Terry Reith with CBC. Go ahead, Terry.
Hi, good afternoon, Dr. Hinshaw. Thank you for taking the call. Manitoba's Premier Brian Pallister announced today that people coming to Manitoba from the west are going to need to quarantine for 2 weeks. With the variant, do you feel that we're going into a period where we're going to need to have interprovincial quarantine periods?
This is something that we saw in the spring where different provinces put in different kinds of interprovincial travel requirements. In Atlantic provinces, that has remained throughout the pandemic. Manitoba did at one point previously put that in place and then lifted it. And I think essentially the phase we're in right now, where we're looking at these different variant cases emerging, is that we do need to look at not just the international travel, but it is important that we're also looking at interprovincial travel. The bottom line, though, is that the public health measures and public health precautions that are in place in almost every province across the country, if we all follow them, we will be able to limit transmission. And so wherever someone is traveling, whether it's to another province or outside the country for essential purposes only, strongly recommend against non-essential travel, that all public health measures be followed wherever someone is. And again, it may be that we see other provinces start to put restrictions in. And again, this is something that can remind us all that traveling outside of our home province right now is not something we should be doing unless for essential purposes.
Thank you all for joining us. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe night.